So it's very common question that after transplant, when should I get back my transplanted hair? So when should I expect my result? So today topic is all about timeline of the hair transplant. So after transplant, what are the events and when should you expect full growth of your transplanted hairs? When you do transplant, for initial 7 days there will be small crust because of the upper skin portions and little bit background redness. After 7 days, so when you do the head wash, this crust will go in 2-3 consecutive head wash. So then it would look like very small hairs over the transplanted hair, which was before like bare skin. Now we can see the small hairs is coming out. So like a trimmed hair. This appearance will be there for next 2 weeks. After 2 weeks, there will be shedding phase. That means the hair, it will get detached from the root level, and subsequently from that area new hair will come. So this shedding phase continues from 2 weeks onwards up to around for next 2 to 4 weeks, that is up to around 6 to 7 weeks post transplant. So this shedding phase is not again like all the hairs will not go into the shedding phase in one go. So like in a phase manner. So what you will see, so some area there is some growth, some area there is a patchy baldness. So this will be the appearance for 6 to 7 weeks after transplant. After that, once that shedding phase is over, then there will be regrowth. But again, this regrowth will be very less, and that time you can see very fine hairs, more of scalp and less of hair. So at this point of time, sometimes we get frequent calls like, doctor, I have done transplant, I think my transplant is not successful, I can't see any results, I am feeling very stressed. But keep this one thing in mind, this shedding phase is completely normal, and for 3 months, so after the shedding phase is over, for next 3 months you won't appreciate any density. So once that shedding phase is over, then after 3 months, like after 12 weeks of your transplant, then eventually they will start growing. This time most of people start feeling like itching over the scalp and some bumps coming up over the transplanted area. This is a good sign in fact. Like this is happening because when the root is coming from inside through outside by penetrating the skin, that's why as a response to that your skin is producing type of bumps. So this is a very normal phenomena. So after 3 months when the hair will start growing, you can see this area gradually becoming black and you can see small twig of hairs is coming out. Maybe when you see it daily you cannot appreciate, but somebody who will see you maybe in every 2 weeks, 3 weeks or every 4 weeks gap, he or she can appreciate the changes, like gradually the area becoming black and the hair is coming back. By 5-6 months you will have around 50 to 60% regrowth of your transplanted hair, so that there will be some changes that you can appreciate, that can be appreciated by others also. You can comb your hair, like suppose somebody having a very completely bald area before the transplant, in that case changes is more appreciable. So you can comb hair, and but again at this point of time the growth is not complete. So the growth will continue to increase gradually in terms of thickness, in the length, and by 9 months we expect around full growth. This full growth may continue up to 9 to 12 months, and sometimes in fact I have also seen the full growth we have achieved at 1.5 years of age. So this is the normal phenomena. First normal shedding, small growth, then 50-60% growth by 5-6 months, then full growth by 9 to 12 months. So after 5-6 months, gradually the density will increase, the length will increase, also the thickness. There are certain factors that sometimes contribute to the delay growth of this transplanted hairs. Like suppose somebody having chronic smokers, suppose somebody having some immunosuppressive treatment, some chronic illness. So in that cases what we have observed that achievement of this full density takes time compared to a normal person. Second important thing is like in the crown area. So where the hair arrangement is different, to have appreciable density over the crown area, it takes little bit more time compared to the front areas. For initial 3 months, don't bother about the density. It is a completely normal phenomena. You just follow your doctor's instruction, have proper diet, increase protein intake, keep your scalp healthy, and follow the instruction as advised by the transplant surgeons. And in 9 to 12 months, you will expect full growth. Thank you.